Hi, all. My name's Jessica. I am with the Friends Committee on National Legislation. I am the Program Assistant in Young Adult Outreach, and I'm here with Amelia Keegan, our Legislative Director on Domestic Policy. And we're here to talk to you a little bit about Spring Lobby Weekend, which is coming up in about a week and a half, March 18th through the 21st. And I'm here to talk to Amelia about what we're going to be doing Spring Lobby Weekend. We'll be focusing on Medicaid and SNAP, but really thinking about what that looks like, what questions we'll be answering, and what Medicaid and SNAP even are. So if we should to just hop into this, can you tell us a little about what we're lobbying on?
Sure. So first, I just want to say how incredibly excited we all are that you're coming. Really couldn't be at a more important time. A ton of stuff is going on Congress, and we really think that your presence during Spring Lobby Weekend could really make the difference on how Congress votes on some of these really important issues. So our big ask for Congress when you all arrive is it's really just to protect Medicaid and SNAP from any cuts or harmful changes.
Okay, and can you tell us a little bit about what those cuts or changes would look like?
Sure, yeah. Well, first, just to explain a little bit about Medicaid and SNAP and what those programs are. Medicaid is a public insurance program, really covers about 70 million people on average, and these are primarily low-income individuals, low-income pregnant women, people with disabilities, many kids, and seniors. And the Affordable Care Act expanded the kind of population of people who could be covered by Medicaid and could get coverage up to 138% of the poverty level. So about 31 states, including and the District of Columbia, accepted that Medicaid expansion, and so the federal government is providing about 90% of federal funding for those states to cover this additional population. And so these programs are Medicaid is in jeopardy right now. Congress is debating right now on some bills that would dramatically cut these programs and totally restructure the way in which they operate, potentially kicking off many people from being able to access health coverage. And then SNAP is the other big program that we're going to be lobbying on. And SNAP, also known as food stamps, stands for the Supplemental Nutrition Assistance Program. And this is our largest federal nutrition assistance program. It helps about 45 million people in this country. And basically, you get a debit card, and you can use that to go and purchase groceries at the grocery store. And so that is another kind of big program where there is, we see a real intent to try and cut that program, and we want to make sure that Congress doesn't do that.
And I'm curious about what kind of overlap there is between people who use SNAP and people who use Medicaid, and whether they would be doubly affected if there were cuts to these programs.
That's a great question. Yes, absolutely. I mean, that's one of these things is I think a lot of times Congress looks at a lot of these programs kind of in a silo and not recognizing just the ways in which they all interact with each other. And a lot of the people who are receiving Medicaid are also receiving SNAP benefits.
Okay. So we talked a little bit about the threat to these programs. Can you talk a little bit about how that threat might happen?
Yeah, good question. So right now, the way that these programs work is that if you qualify for the program, if you're eligible, you automatically get the benefit, right? So if you are kind of within that income threshold or one of the specific categories of individuals that is eligible for the program, you automatically get the benefit. What Congress is looking to do with both Medicaid and SNAP, though in slightly different ways, is essentially say, you know what, we're not going to do that anymore. We're just going to give a chunk of money to each state, and it's up to that state to distribute the money. And you know what, if there's some sort of spike in need, if we have a health outbreak or a recession, and either more people become eligible for the program or healthcare costs, skyrocket. Too bad. The state still has just that amount of money, and so it's then has to distribute that same amount to either more people or people who have greater need. And so what's the state going to do? They don't have a lot of options. They can either take money from education or public safety, but more likely what the state's going to do is it's going to either cut benefits or it's going to cut eligibility and kick people off of the program.
And so what you're talking about, this would be called a block grant, right?
A block grant, yeah. So a block grant is one of the things that we have seen proposals coming out of Congress to do for both Medicaid and SNAP. The other thing that we're hearing is something called a Medicaid per capita cap. It's pretty much the same thing, but instead of what Congress would do is they say, okay, here are all the people who qualify for Medicaid in your state, and we're just going to give you that chunk of money. We're going to cap it per person and give you that chunk of money. And what the big problem with that is that, healthcare costs are rising dramatically, right? And so the increase, the amount that, the state's going to get next year and the year after that and the year after that, that growth pattern is much smaller and much slower than what healthcare costs are actually rising at. And so essentially, over time, we expect to see about Medicaid cut by about $370 billion. And that's money that the states would then have to pick up. The other piece of that is, I talked about the Medicaid expansion piece under the Affordable Care Act. So these 11 million people who now have health care coverage because of the Affordable Care Act under Medicaid, would no longer get it, because there are proposals right now that Congress is debating and voting on that would repeal the Medicaid expansion.
So you talked a little about this. Even with the way things are going now, there's still harmful aspects to the way these programs work. So how would this be even worse if they were cut? It seems like even now it's not growing. The programs aren't growing at the rate that they need to be growing. If the programs were cut, how would that be worsened?
Well, right now the programs grow automatically. Okay. So if we do see a spike in need, it's great because we don't have to wait on Congress to try and pass any bill or do anything. Those programs just automatically expand. But if these proposals do get enacted, then we wouldn't see that growth wouldn't happen automatically. So that would be a major problem.
Gotcha. And I'm curious if we've seen something like this in the past and what effect that's had and how we can learn from that going forward.
Yeah, great question. So I'll give two examples. The first is back in 1996, we saw with welfare reform, we saw the same thing where Congress took essentially what was then welfare and turned it into a block grant. What is temporary assistance for needy families, or called TANF. And what we have seen is the exact thing that we are worried about, right? So essentially federal funding for TANF has totally been pretty much flatlined. We haven't seen it expand at all with growing population or growing need or rise in cost of living and all that sort of stuff. It's really been flatlined.
And it still exists?
It still exists, but the problem is you look at back in before welfare reform, the number of people who are living in poverty or living below the poverty line or eligible for TANF, the number of people who got that benefit was much greater. Now that program just doesn't really function in any sort of effective way anymore. We see far fewer people actually being able to get those benefits. And one great example is in the Great Recession that we just had. We saw, you would think that those sorts of programs that are supposed to be there when the need really spikes, we saw food stamp, SNAP, it did exactly what it was supposed to do. We saw it expand a lot, more people became eligible. That didn't happen at all with TANF. And so that's one of the huge fears, is that all of a sudden people wouldn't be able to access food stamps when they needed to, or be able to get health coverage when they needed it. The other thing that I think, and I think this is really, really important, is that we have seen these proposals to put Medicaid and SNAP into block grants or this per capita cap over the past few years, but they've only been proposals coming out. But now with both you know, the same party in control of both chambers of Congress and the White House, it's going to be a lot easier for them to be able, all of a sudden, these are not just kind of proposals that are out there anymore. They have a lot of traction and they're actually moving.
So speaking a little bit about healthcare, we see and proposals moving. Right now we're seeing a lot of action around the Affordable Care Act. I'm curious about how that ties into Medicaid and SNAP and the threats that they're also facing.
Yeah, great question. So the Affordable Care Act, it's not addressing a lot with SNAP right now, but Medicaid, huge, huge, huge. And I think we just saw on Monday a new members of Congress came out with a proposal, their sort of repeal and replace proposal. And what would that proposal do? It would institute a Medicaid per capita cap, the exact thing we're concerned about, and it would repeal the Medicaid expansion. And so we could see, you know, just tens of millions of people losing their access to quality, affordable health coverage because of that.
Wow, so it seems like there are a lot of things at stake right now. So that leads me to my next question. Why is now the time for people to be coming to Spring Lobby Weekend, for people to be engaging their members of Congress and really talking to other people about why these programs are so important?
Well, this could not be a more important time. Like literally the days that we have for Spring Lobby Weekend are kind of going to be the days leading up to some of the most important votes that we're going to see. You know, we have seen the new Congress really struggling, especially around healthcare. They wanted to enact repeal and replace of the Affordable Care Act on day one. We're now a couple months in, and we have yet to see that. They're feeling a lot of pressure to try and move something. And the thing that they are trying to move and that they want to get done before they go home for the April recess is a bill that would institute this per capita cap, essentially cut Medicaid and dismantle the program in a way that would be totally unrecognizable. And so that I think is really, really key in terms of timing. I mean, literally that week we could see some really key votes in the House and potentially in the Senate. And congressional leaders feel a lot of pressure to move and to get their caucus behind them. So hearing from constituents, you know, there's a lot of talk in DC about this right now, but it's really going to be kind of hearing from folks outside DC and those voices that is really going to change how this plays out. And then later on, we are expecting to see some real potential threats to SNAP. And so it's really important that members of Congress know right now that there is a clear and very forceful opposition to any sorts of changes that would dramatically cut the program, such as a block grant.
So I have two questions out of that. One is, are members pretty torn about this issue? How are they feeling about it? And how much of a influence do you think constituent lobbying would have? And then you also talked about these implementations making these programs unrecognizable. So do you think that it might be something similar to TANF, and what kind of effects that would have?
So to answer your second question first, absolutely. I think that is a huge fear. We know that these sorts of changes, the block grant and the per capita cap, what they are really there to cut the programs. That is the biggest fear, and that's what they do. And if you look at the budget window over time, it ends up cutting the amount of federal funds going to these programs. And so that is absolutely what we are worried about seeing. I think in terms of timing and where members of Congress are at, it varies for each member of Congress, but I think they absolutely need to hear from their constituents. You know, I'm on the Hill all the time talking about to members of Congress and their congressional offices about this very issue. And I get a very wide range of responses. But a lot, I think, are really, these are big changes to some of our major federal programs, and especially on Medicaid, they are moving so fast. This bill came out on Monday. They're marking it up in committee right now. So they are moving so quickly, and I think there is some hesitancy among a number of members of Congress about just moving so quickly on something that would have such a dramatic impact on so many people. And so they want to hear from their members of Congress. I have seen so many times where members of Congress have changed their position or have come out much stronger on a certain issue because they've heard from constituents in the district. So yeah, I cannot say enough how important that is.
So there seems to be a lot of urgency on the Hill to really get this passed. And I'm wondering, what are the main arguments for this? Why is there such a rush to cut these programs? Sometimes you hear about fraud in terms of these programs. So can you debunk those myths a little bit?
Yeah, good question. So first, on the timing thing, I think many members of Congress are just worried about, this goes directly to that point of what constituents say matter. They are very worried about going back to their districts and wanting to know before the April recess. A lot of them got hammered pretty hard in the last district in a lot of those town hall meetings, and they want to get this done before they have to go back and face that again. So I think there's a real urgency on that respect. But I think in terms of some of the arguments we hear, why propose block granting some of these programs? And I think the biggest one that I think I've heard two major ones. One is a flexibility argument, and one is a cost argument. So a lot of times you'll hear congressional offices say these programs are just too big. We're spending too much money on this stuff. And I think for the most part, I think it's important that we have programs like SNAP or food stamps and Medicaid there and available, able to provide adequate benefits for people when they need them. I can't imagine what this recession would have looked like if we didn't have programs like SNAP and Medicaid. So I think those, and it's not like these are lavish benefits. SNAP provides, on average, it's $1.40 per meal. That's not like super generous, right? So I really don't think, I'm on Capitol Hill quite a bit. I have to tell you, I never get the sense, looking at kind of what they're debating, what they're talking about, and what they're spending money on, that addressing poverty is too much of a priority, right? Like, are we really spending too much of our effort and government resources really addressing poverty and income inequality in this country? No, we're not. Like, so I think for me that's not a great example. And so that's the kind of the cost argument. The fraud argument, I think it's just like the facts don't face it up. They back it up. We know there's less than a 3% error rate in SNAP or in the food stamp program. Less than a 3% error rate. And so compare that with like our Pentagon budget. Compare that with our tax code. Like, there are so many other areas in our federal budget that have far bigger error rates or fraud rates than these programs. So I think a lot of times it's just, what I see is a real effort to just kind of more derogatory and not understanding kind of how these programs work.
Yeah, it seems like there's a lot of criminalizing the poor, and
absolutely. Absolutely, yeah, and I hope that we get to talk a little bit more about that during Spring Lobby Weekend, because you look at the penalties for, say, for committing any sort of fraud in this food stamp program, and it's astounding. I mean, what other things you can do, and what other crimes you can commit and get lesser penalties than that. So it's those sorts of double standards are just outrageous. And then the other thing I hear a lot is people talk about flexibility. They say, you know what, giving over just a chunk of money to the states, that just provides more flexibility, and states, they know what best to do with that funding. And I think there are a couple kind of responses to that. One is there's already a lot of flexibility in these programs. Like Medicaid, there's kind of some general guidelines, but states have a lot of room to be able to move with that program.
And that actually leads me to my next question. So we've talked a lot about the federal government and their role in this, but what role do states have in programs?
Yeah, so that's a great question. So it differs between the two programs, but for Medicaid, it's both are like federal programs, but they're sort of administered by the states. So the states have kind of the responsibility of administering those programs. For Medicaid, it really varies much more than SNAP in terms of what your benefits look like based on what state you're in. First of all, if you're an expansion in a state that took the Medicaid expansion, then all of a sudden you can be covered up to 138% of the poverty line. But those eligible, for Medicaid, there are certain populations that states have to cover, but then there are other kind of more optional populations. So many of those include like individual, especially if you don't have kids, you're oftentimes not covered. And in some states, it doesn't matter what your income level is. You still might not be covered. So, but that's one of the benefits that Medicaid expansion did, was those states, even if you don't have kids, if you're up to 138% of the poverty line, you can still be covered. So things like that. The other difference is the amount of money that the federal government helps contribute differs per state for the regular Medicaid population. For the expansion population, they pretty much cover everyone up to 90, at least 90% of that cost. But for kind of the ordinary kind of traditional Medicaid population, the amount that the federal government contributes is much less, and it depends on what state.
So you talked a little bit about how giving this block grant provided flexibility. So does this money not get assigned specifically for Medicaid?
Well, it depends how it's structured. It would be, but it's kind of like how that state wants to give out that how they want to structure that, and what the eligibility requirements are kind of differ by state. One thing we did see when TANF was we saw TANF turned into a block grant, is that states, especially with the block grant, states oftentimes would use that funding for other purposes, sometimes fine purposes, but just not what the funding was intended for. So, that's a huge fear with SNAP. If SNAP becomes a block grant, all of a sudden, most of that funding right now goes to actually food, helping people eat, right? And so if state budgets, a lot of them are not in great shape. They are looking for additional revenues. They don't want to, a lot of them don't want to be, raising taxes, or their budgets aren't in great shape. And so if they're getting a chunk of money from the federal government, there's a real temptation to try and get around and use that money for other purposes. So sometimes they're able to do that depending upon how the block grant is structured or something like that.
Gotcha. So it seems like there's just a lot going on here. It seems very complicated, but at the end of the day, it seems like this really affects people. It comes down to being able to eat, being able to go get a physical, have a regular doctor's visit. So I think it's really important to keep that in mind when we start talking about the nitty-gritty, wonky side of policy.
Absolutely. Like, I think at the end of the day, there's these programs, how they're administered, a lot of stuff gets really complicated. But I think at the end of the day, what we're seeing are proposals to just cut these programs, to dramatically cut these programs by billions of dollars. And that's, as you said, that's going to be hurt people. And that's going to, the people who are going to be hurt by this are oftentimes, you know, those who can't hire really high paid corporate lobbyists who are going on Capitol Hill. You know, I spend a lot of time on Capitol Hill. There are a lot of corporate well-paid lobbyists. There are not a ton of lobbyists out there who are really advocating for these sorts of values and these sorts of programs. And so that's why I think it's so much more important that that this message really gets carried to Congress.
And why it would be so important to have 450 lobbyists come out and really talk about these issues and why they're so important and share their stories. And yeah, start helping to build those relationships with members of Congress.
Yep. I think, you know, given the timing and given just the energy and the number of people who will be at Spring Lobby Weekend with all you coming, I know that can tip the balance of how some of this stuff comes out. And that is so huge. You have this opportunity to really change some of the biggest questions that are before members of Congress right now, and you're going to play a part of that, and you're going to impact that, and that is so huge. And if all goes well, I think we have a real good shot at winning on this stuff. And this is, you know, we're in a climate where winning usually means not seeing really bad stuff happen, and it doesn't always feel as good as like getting a really good bill passed, but sometimes preventing the really bad stuff from happening is so I mean, it's just as important. And I think we can really make a mark in the next few weeks.
Yeah. Well, we at FCNL are really excited to have you. Thank you so much, Amelia, for this.
Thank you.
That is all of my questions.
Great.
Is there anything else that you want to add?
No, I'm just so excited to see everyone. We are counting down the days. Everyone's getting ready. We're all pumped. I hope you're pumped. Yeah, and I can't wait to see you all soon.
Yeah. See you soon.